I'm Elora and I'm here with Dr. Anthony Yeung. He's one of the most renowned and innovative spinal surgeons in the world. So today's topic is we're going to see how Dr. Yeung has achieved such success in running his own practice throughout these years. And also the purpose of the interview is to give medical students and viewers a sneak peek of what it's like to be a spinal surgeon in your shoes. So Dr. Yeung, before we dive into that, can you tell us a little bit about yourself?
It's a very long story. I don't know how to condense it. But I'm not the typical fresh off the boat person from China. I came over in 1949. And I was privileged at that time because my father was high-end. He went to Sun Yat-sen University. He represented China in the Eastern Olympics. My mother was a broadcaster who was born in Portland, Oregon, that was taken back to China by her father. And she became known because she was a very nice looking girl. She went to Beijing and she was part of the group that was Puyi's court. So she went to Beijing, True Light Girls School, and she was accepted by the Chinese at that time when Puyi was the puppet person for China.
Right.
And so that's how she got her start. So I consider myself privileged. I came over here mainly because when we arrived in the US, we left everything behind. We had wealth, we had prestige, but because of my mother, she's told me, Tony, you don't want to start owning restaurants, working grocery stores, being middle management. You have to be at the top. And how do we do that? At that time, my father stayed behind. And I went to high school. I was actually a year younger than my colleagues. So I decided, okay, the only way to do that is to work harder than everybody else. Not that I'm the best, but I worked harder. And that formula has driven me to what I'm doing now.
Right. Yeah, and from that, so you pretty much came here and start afresh from almost nothing, almost like a rags to riches stories. And through your dedication and hard work, you got to where you are now. Can you tell us a little bit about, your awards and what you've accomplished throughout these years? Right. Currently, you're retired, but throughout the years, what have you?
Yeah, I think the awards are not important.
Right.
It is nice that I'm recognized, and I'm recognized a lot more by my Asian students than the American students or the European students, because I think they have a problem recognizing Asians as being on the top. So I took that as an incentive for me to work harder. So I would say nobody can work as hard as I can. I don't have to be the smartest, but I want to work the hardest.
Right. So why did you end up choosing spine as a specialty?
Some of it was luck. I was scheduled to be drafted to go to Vietnam in 1971, and I had a middle draft number. There were no residencies available because I was supposed to go in, but when I told my program director in Arizona, he happened to like me a lot because I was an intern under him. So he made a place for me in 6 months, even though the position was filled. And because of that, I got an orthopedic residency, and as luck would have it, when I was ready to go in 1975, Vietnam was ending. And so otherwise, I would have gone as an artillery officer, or I would have been in the Navy. But I picked the Navy because if you're a specialist, you have to be back where the base is, and you have a higher rank. So I went in as a lieutenant commander with my first tour of duty in the Philippines in Subic Bay, 1975.
Wow. And what was your experience like as a surgeon in the Philippines?
I had the best time that I can imagine because I was valued because I could do spine surgery. And it so happened my commanding officer was a captain in the Navy. And because I could do spine, he says, okay, I'll let you do it. And I also was trained to do children's orthopedics.
Okay.
And so in my last year of residency was for crippled children, with people with scoliosis and deformities. So because I had that background,
Right.
I felt comfortable doing spine surgery as a naval officer, whereas before that there was nobody in the Far East that's able to do that.
Wow, so you're the first.
I was lucky.
Wow.
Timing. I could have been in Vietnam, you know, maybe in the Army
Right.
as an artillery officer or something like that.
Yeah. I mean, it sounds like from just our conversation now that you're such a hard worker. I feel like it's more than luck, doctor. Like it's a combination of your hard work, your endurance, and also your intelligence because, you know, luck can only take you so far, right?
But I had to admit that I was fortunate to be liked by people who can influence me.
Right.
The head of my program was the heir to Johnson & Johnson.
Wow.
And for whatever reason, he liked me. So when I asked for residency, she said, you have to wait 6 months and I'll open up a spot for you.
Right.
So because of that, and that's luck, but I didn't want to let him down. So I make sure that I worked hard. And because we didn't have any money coming over here, I figured I had to do whatever it takes to get scholarships. So, and I also was in student politics. So I ended up being president of the senior class, and I got scholarships to go to Arizona. I had a Baird scholarship in chemical engineering, but I decided that wasn't for me. I wanted medicine because, you know, I like doing things. So I gave up my Baird scholarship to go get a general resident scholarship at University of Arizona.
Wow. So from residency to practicing as a spinal surgeon, do you remember what it was like in regards to the expectation of going into practice versus, you know, being trained during residency?
In the beginning, I was very laid back. I was recruited to join the biggest group in town called the Orthopedic Clinic. And these are my professors in the residency program. So for the first 10 years, I just worked and didn't say very much, but I continued to learn more from my teachers. Then after 10 years, I decided it's time to branch out on my own. So I opened an ambulatory surgery center after being promoted by the hospital that I worked at, because I was doing lasers and spine surgery. And it got some of the Caucasian and other spine surgeons who were fellowship trained, they didn't know how to handle it. So they were trying to find ways to slow me down, but it only made me work harder.
Right.
So it was circumstance.
Yeah.
Okay? But I always like to say that I'm never the smartest, but I'll work the hardest.
You're very humble, doctor.
No, well.